Welcome to Crisis in Care. Who moved Zimbabwe's healthcare? A podcast where we trace the cracks in our hospitals, the names behind the numbers, and the voices rising from the chaos. I'm Human, a Zimbabwean in the diaspora, a human rights advocate, and your guide through the maze that is Zimbabwe's collapsing healthcare system. This isn't just another podcast. This is an autopsy of neglect, a map of corruption, and a blueprint for resistance. We'll walk hospital corridors with no lights. We'll meet families who lost everything to a system built to fail. And we'll ask the questions no one in power wants to answer. Who moved the cheese? Who benefits from the suffering? And how do we build a path out of this maze? You'll hear from whistleblowers, grieving relatives, policy experts, and everyday Zimbabweans fighting for dignity, justice, and healing. Because this isn't just about broken hospitals, it's about broken trust, and it's time to fix both. So join me, episode by episode, as we expose, remember, and reimagine. This is Crisis in Care. Let's find that cheese, together. Imagine a hospital where the newest piece of equipment is older than Star Wars, Disco, and the first test tube baby. That's not history. That's Zimbabwe's healthcare system today, where 2,500 mothers die each year because basic medical care has become a luxury.
You know what really gets me about those numbers? That's like having a plane crash every 3 weeks, but because it's happening one person at a time, it barely makes headlines.
And here's the thing. We're not just talking about statistics. Take Tatenda Pingisi's story, a beloved 34-year-old artist who died not from his accident, but from waiting hours for emergency care that never came.
That reminds me of another heartbreaking case. Moila Zvanyanya, a nurse who died giving birth in the very hospital where she worked. The cruel irony is that she spent her life saving others, but when she needed help most, there wasn't even enough blood available.
Let's dig into why this is happening. The government promised to spend 15% of their budget on healthcare under the Abuja Declaration. Want to guess how much they're actually spending?
Given what we're seeing, I'm guessing it's nowhere near that target.
Right. They're hovering around 8 to 9%, which translates to about $1.2 billion for 15 million people. That has to cover everything. Salaries, medicines, equipment, the whole system.
Well, that explains why Sally Mugabe Hospital is still using equipment from 1977. But here's what I don't understand. How does a country justify having new government SUVs while their flagship hospital can't even keep both maternity theaters running?
That's exactly the point. It's not just about resources, it's about priorities. And speaking of priorities, let's talk about what happened to all those COVID millions that were supposed to buy ventilators and supplies.
Oh, right. I saw those posts on social media asking where that money went. The health ministry gets flagged for questionable deals every year, but somehow nothing changes.
You know what's fascinating, though? When you look at neighboring countries like Zambia, they're working with similar constraints, but managing to do more with what they have.
So what you're saying is this isn't just about being broke. It's about how resources are managed.
Precisely. And here's where it gets interesting. There are actually some pretty straightforward solutions that could make a real difference. Take public-private partnerships, for example. South Africa has had success letting companies upgrade hospital wings in exchange for tax breaks.
That makes so much sense. And what about the diaspora community? They're already sending billions in remittances. Imagine if that power could be channeled directly into healthcare infrastructure.
Speaking of power, we're seeing something remarkable happening on social media. Zimbabweans in the UK are organizing fundraisers, lobbying MPs, really building a movement around this issue.
You know what gives me hope? Rwanda managed to dramatically reduce their maternal death rate. If they can do it, Zimbabwe can too, with the right focus and commitment.
Let's break down what that would actually take. First, you need to redirect about 10% of the current health budget to key hospitals. That alone could transform them within 2 years. Modern wards, working equipment, stocked blood banks.
And don't forget about the healthcare workers themselves. Just paying them on time and giving them proper equipment would make a huge difference in retention rates.
Exactly. It's amazing how many doctors and nurses would stay if they just felt respected and supported. But there's another piece to this puzzle: rebuilding trust with international donors.
That's where transparency comes in, right? Organizations like WHO and UNICEF want to help, but they need to know their support won't disappear into a black hole.
And this is where citizen action becomes crucial. The number Fix Our Hospitals movement is gaining momentum, with people sharing stories, organizing protests, really keeping these issues in the spotlight.
Well, that's what makes this moment different. People aren't just accepting this as normal anymore. They're demanding change and backing it up with action.
You know what's powerful about this moment? It's not just about exposing problems, it's about showing there's a way forward if we're willing to fight for it. Behind every statistic is a real person, someone's mother, sister, friend.
That's really what gives this story weight. It's not just about policy, it's about human rights and dignity.
And that's where real change starts, not with grand government promises, but with citizens saying enough is enough and working together to build something better. The system might be broken, but the people aren't giving up.
So what you're saying is this isn't the end of the story, it's just the beginning of the work that needs to be done.
Exactly. And that work starts with keeping these stories alive, demanding accountability, and supporting the people and organizations fighting for change on the ground. Because at the end of the day, this isn't just about fixing hospitals, it's about saving lives. You've just listened to Crisis in Care: Who Moved Zimbabwe's Healthcare? Where the maze is real, the pain is deep, but the fight is still alive. We've traced the broken paths from Sally Mugabe's failing theaters to empty blood banks to lives like Tendai Moila and Tatenda Pinjisi, lost not by accident, but by design. We've seen the system expose the silence, and now the next step is ours. Speak out. Use the hashtag #, Fix Our Hospitals on X. Tell your story, because the more we speak, the harder we are to ignore. Support real change, donate, volunteer, pressure your MP. And if you're in the diaspora, your remittance isn't just money, it's power. Use it to build, lobby, transform. This isn't where the story ends. It's where the resistance begins. Visit my X for resources, action steps, and ways to get involved. Follow me on X and join the movement. I'm human. And this has been Crisis in Care, where we expose the wounds and fight for the healing. Until next time, keep walking, keep watching, and keep sniffing for that cheese.